Hi guys, my name is Aditya Santosh Jadhav. I am from second year MBBS class from college Dr. Ullas Patil Medical College and Hospital. Today my topic is sedative hypnotics. Now let's start with sedative. Now sedatives are the drugs which calms down the patient and hypnotics are the sleep inducers. Okay. Now uses of this sedative hypnotics. Uses are they are used in acute anxiety, acute mania, and acute psychosis, insomnia, seizure, and general anesthesia. Now, their mechanism of action. Now, their mechanism of action are mainly on neurotransmitter. Then, neurotransmitter are of two types. First, inhibitory and excitatory. In inhibitory, GABA and glycine are the ones. In excitatory, glutamate and aspartate. There is no role of acetylcholine or any other neurotransmitter because they can both act as inhibitory as well as excitatory. Now, aim of sedative hypnotic drugs: they decrease excitatory neurotransmitter and increase inhibitory neurotransmitter. Now, let's come upon the GABA. Now, GABA acts upon three receptors. Now, GABA A is an ion channel receptor which is present in CNS. Okay. And then GABA B is a G protein coupled receptors. Okay. Now GABA A is I already told you it is an ion channel receptor. What does it do? It has two channels on the CNS cell membrane. Okay. It does chloride. It transport chloride from outside to inside the cells. Now the cells, due to chloride, the internal environment become negative and the cell is hyperpolarized. If cell is hyperpolarized, the cell is depressed. Now cell is depressed. Which cell is depressed? CNS cell. That's why CNS depression may occur. That's okay. Now let's go with the 3D view of chloride channel. Now every channel is a pentameric. Every chloride channel is a pentameric. It has 2 alpha, 2 beta and 1 gamma subunits. Now GABA bind to alpha beta interface. Now benzodiazepines are the drug which bind to alpha gamma interface, are GABA facilitatory. How they are GABA facilitatory? They increase frequency of chloride channel. And the another class of drug, barbiturates, are mainly acts upon the beta, are beta binder, are mainly act on beta. They increase duration of chloride channels. That's why they may cause seizures or extrapyramidal symptoms. They also increase duration of chloride channel opening. Now these type of drugs can't use if patient had seizures, epileptic symptoms or tremors or something. Now let's start with the benzodiazepines drug. Now benzodiazepines are the drug which has pharmacokinetic. They are no enzyme inducer. They also produce less hangover, less abuse potential, and if toxicity occur in some cases, the flumazenil is an antidote which is present for the reaction. Except for barbiturates, if barbiturates poisoning may occur, it don't have antidote. That's why benzodiazepines have flat dose response curve. And flat dose response curve, I'm showing you this. Benzodiazepines, no enzyme induction, less abuse, less hangover. In case of poisoning, flumazenil antidote may given, and they produce high anterograde amnesia, and they have flat dose response curve. Now you are seeing this curve in the PPT. I'm showing this is benzodiazepines, which is flat, which is in pink in color, and the red one is the barbiturates. Now you see there are 4 stages of the toxicity. First, hypnotics, they may cause hypnotic, they may cause general anesthesia, they may cause, in higher doses, they may cause respiratory depression and ultimately death. But see, benzodiazepines have a flat dose response curve, but barbiturates have steep curve. It means if barbiturates poisoning may occur, it may lead to death. Now, the drugs of the benzodiazepines are diazepam. If diazepam given through rectal route, it is the treatment for the febrile seizure. Or also diazepam may use for generalized tonic-clonic seizures, epilepsy, tremors, or in many cases of mania, bipolar disorders, or many things. Now second drug is lorazepam. Lorazepam in IV form, it is a drug of choice for status epilepticus. Also it is for acute anxiety, acute mania or acute psychosis. Okay. Now this is the classification of the drug. Sedative hypnotics. These are shown in the flow chart. Benzodiazepines, you may see hypnotic means they cause sleep. They constitute diazepam, flurazepam, nitrazepam, alprazolam, lorazepam, temazepam and triazolam. Now anti-anxiety drugs are diazepam, chloral diazepoxide, oxazepam, noroxazepam, aprazolam, clonazepam. And anticonvulsant drugs are clonazepam, clobazam, diazepam, lorazepam. Now non-benzodiazepine drugs, but they also act as a benzodiazepines, but are not benzodiazepines. These are called as Z drugs in classification. Zopiclone, zolpidem, zoleplom, yes, and other hypnotics, tricloflos, melatonin, ramilton, suvorexant are the drugs which we will discuss further. Barbiturates are of three types. Long acting, we only see phenobarbital. Short acting, butobarbital and pentobarbital. Ultra short acting, thiopentone and methohexitone. We see. Now let's come with a benzodiazepine. See, you can remember the drugs from this: diazepam, lorazepam, chlordiazepoxide, clobazam, clonazepam, alprazolam, oxazepam. Now we can see chlordiazepoxide is drug of choice for delirium treatments. We know delirium in older age people having Parkinson-like symptoms, so we can treat it with the chlordiazepoxide. Now clonazepam and